So for shoulder function, one of the tests that we use is called shoulder abduction or abduction, and it's literally, can you get your arm to go out from the side and have the bicep touch the side of the head, which is a fairly full range of motion and what the shoulder joint should be able to do. So when someone comes in presenting with shoulder pain, that's the first thing we're going to look at. So we're just going to check on this shoulder how much abduction we've got. So do you want to just bring that up overhead? So then if we look at this end range position, we've got about a 4-finger gap here at the end, and then we ask them what they feel. And usually there's either some sort of symptoms or there's tightness, and we'll want to know where that is. But basically in a shoulder like that, we're going to go and have a look at the structures that would block that movement, check them for adhesion, check for nerve entrapments around the shoulder, and start there. So we've just run through feeling through the nerves in the armpit, the axilla region, and he's got some nerves that are pulling really tight when the shoulder's going into an overhead position. So we're just going to start working through some of those and see if we can take some tension away. And then we'll retest the abduction. Good. Good. So just come up again. So we've got probably 2 fingers, maybe 3 fingers there. What feels tight now?
Always more like,
So like through the lat? Okay. The armpit region is just a mess of nerves. There's so many in here. So we've just treated the bundle that runs up from the shoulder into the neck, and it's improved the range of motion. But now the symptom has actually changed, and where he's feeling tension is actually different. So we're going to repalpate now and actually check for something else, and then we'll see if we can treat that and improve the range of motion further. Just there. That doesn't feel good there. All right, let's see if we can get some tension on this one. There, good, that's peeling away. That's better. All right, so we're getting closer bicep to ear. So now we probably get 2 fingers in there. We can probably get it down to 1. What do you feel now in that top end?
We're just going to feel it jams up top a little bit.
So we're going to treat the subscapularis muscle on the front of the shoulder. It's a really important stabilizer for the shoulder, but it also has to lengthen to allow an overhead motion. So I've just palpated through the muscle. There's a mild, moderate amount of adhesion in it. It's fairly focal. Most of the muscle feels pretty good, so we're going to treat that now, and then we'll retest the motion afterwards. All right, so we got the bicep touching the ear with a little bit of effort, but we've come down from a 4-finger gap after treating, what did we treat, about 3 or 4 structures. Most of that was nerve entrapment and a little bit of muscle, and it's opened up that shoulder position.